You know, I think we're seeing a couple of things. There's a tremendous amount of excitement in CLL. The drug Venetoclax, which is a BH3 mimetic, we already have known from the phase 1 data is a potent drug for the treatment of CLL, but we're now seeing additional more mature data, some of it in the first line setting, demonstrating really remarkably high complete response rates. Even in the relapse setting, we're seeing minimal residual disease achieved in upwards of 40% of patients. And with those sorts of advances, we can really start to think about combining some of the new exciting agents in CLL, including idelalisib, including ibrutinib, including ACP-196 and many others, into a treatment paradigm that really may change the natural history of CLL. In lymphoma, one of the sort of interesting things that we've seen, there have been a couple of studies that have looked at what we call cell-free DNA. Tumors, as they grow, some of the cells are constantly dying, and those cells, as they die, they break up and their DNA is circulated in the bloodstream. And because of the power of the new next generation sequencing platforms, we can identify minute amounts of DNA in the blood that actually are derived from the tumor. And it gives us a way of identifying abnormalities and things in the tumor at diagnosis, even though we haven't biopsied the diagnosis. The investigators have called these liquid biopsies because they're from the blood. And it also gives us powerful tools to monitor disease over time. And so there have been a couple of these studies looking at cell-free DNA, and that's actually, I think, a very exciting area as well.